been exactly 1 week since the mass overdose in Baltimore's Penn North community.
And there are several new developments to tell you about tonight. According to our media partner, the Baltimore Banner, a research chemist at the National Institute of Standards and Technology now determined it was fentanyl laced with a powerful sedative that caused this overdose.
As we told you yesterday, Baltimore City Police have arrested a number of people for selling drugs in the same neighborhood in recent days. So in less than a half hour, the mayor's office will hold a community meeting to get feedback on the city's overdose response strategic plan and hear from neighbors about their experiences. The meeting starts at 5:30 at Gethsemane Baptist Church. And tonight, WJZ has an exclusive update about 2 of the 27 victims from last week's mass overdose, a man and woman who are currently receiving treatment at the Tuerk House, a behavioral health center designed to help recovering addicts.
And Stefan Dingle live in the Penn North community tonight, taking us inside their facilities. And Stefan, how are those victims doing tonight?
Hey there, Rick and Nikki. Good evening to you. A man in his 50s and a woman in her late 30s, early 40s are said to be hopeful about their recovery journey at the Tuerk House after they consumed what we now know was a bad strain of fentanyl that could have taken their lives.
A scary situation, something that I've never seen since I've been in this field and as long as I've been working here.
1 week ago Thursday, it was a mass response to a mass overdose. 27 men and women were strung out along one of Baltimore's most notorious open-air drug markets at Pennsylvania and North Avenues.
Of course, when we headed, we were all on alert. I called the staff. Everybody was on high alert.
With the assistance of Tuerk House to see what I could do to help the clients and make sure that they go on and getting referred to the correct places.
For 2 victims of the mass overdose, that right place was at the Tuerk House in West Baltimore on Ashburton Street.
This looks like a really bad strain of fentanyl that was put out there.
A woman in her 30s or 40s and a middle-aged man are currently rehabbing at this facility.
One's downstairs and one is right here in this room right here. Yeah, we have a 50-year-old male patient who was affected by the situation over at Penn North. He came here from the hospital. He's getting his detox. This is where he's staying. He has a full shower here. We have 24-hour nursing, which we have a provider, and we also have individual counseling.
Compassionate care with no judgment, no matter how many relapses. Tuerk House wants to inspire those struggling with addiction, even after a mass overdose that nearly took their lives.
From what we're hearing, they are hopeful. They have other people in there, and like I said, they have peers who also engage with them and talk to them and give them that glimmer of hope, you know, that you are not in this alone.
They're on the street, so this is home. So when they come here, we want them to feel like they're home, because that's why we're called Tuerk House.
Now, one of the big concerns of many in this community is, will that massive response and the help with resources, will it be here in the days, weeks, and months to come? Coming up tomorrow on WJZ, we go back to the Tuerk House to profile their Crisis Stabilization Center, which is open 24/7, and how they're helping anyone who wants to beat their addiction. For now, we're live at Penn North here at 5 o'clock. I'm Stefan Dingle for WJZ.
All right, Stefan, thank you.